Hello and welcome. You're listening to Ending Physician Overwhelm with Dr. Megan Mello. In this podcast, we look at why, as physicians, we often get stuck in feelings of overwhelm, anxiety, and burnout, and how we can break out of toxic thought patterns. My hope is that each episode gives you an opportunity to heal and to get more clear on how you want to show up in your life and your work. And now, let's get started. Hello, and welcome to episode 7, You Are Not Your Thoughts, with Dr. Jillian Rigert. I'm going to put a trigger warning on this episode. So we will be discussing thoughts of suicidal ideation and eating disorders in this episode. So if you find these topics triggering, then I would encourage you to skip this episode and join us another time. And with that, let's get started. So Dr. Jillian, thank you so much for joining me today.
Thank you so much for having me. I'm so excited to be here, Dr. Megan.
So one of the goals that I have for this podcast is creating spaces for physicians to share their experience with burnout, overwhelm, and emotional exhaustion, and working to reduce stigma and shame that we experience in conjunction with mental health. And I've heard you speak, and I've read your writing that you shared so publicly and candidly about the very real dangers that you faced with mental health. And so I'm hoping that you will start us off by just sharing some of your story.
Yeah, absolutely. And so the articles that you would be talking about are on KevinMD, and they talk about my experience with what now I understand would be termed burnout. And I developed problems with what I knew at the time as some just dark thoughts, and didn't even have the name depression in my mind. It just felt kind of like my brain was hijacked with thoughts that were very negative. And I was a surgical resident at the time in oral surgery, and I was in the military. And I was developing these deep, dark thoughts at times where I was under high stress, and especially at times of sleep deprivation. And during those times, I had very limited amount of capacity to think in a healthy way. And what I mean by that is that I felt I was going to work, I was surviving, and I was so exhausted that I thought, I don't know if I can continue doing this. And the thoughts were very limited with making it through the day. And then at the end of the day, I would just be so exhausted. I would think I may be better off if I take my own life. So that's a big part of my story. And at that time, it was 2014. And I hadn't yet heard the term burnout. I hadn't really understood that it was pretty ubiquitous to have some problems with depression and some anxiety and things like that in medicine. And so I thought I was alone. And feeling alone contributed more to the intensity of the suicidal ideation because I thought I was broken. I thought I was the problem. And my story is quite long, so for the sake of time for today, I'll just share that ultimately I got to a point where the decision to continue surgery or not was what felt like to me a decision of life or death. And at that time, one of my key coping skills that we'll be talking about was anorexia. So to cope with the feeling of depression and anxiety and what I had developed, which was feeling like a tremendous psych ache, was using eating disorder behaviors. And that led to increased mental health issues and then also some physical, I was medically compromised from the physical complications of that eating disorder. So with all of that, I had decisions to make with my career. part of it was led by the medical compromise and say, I'm at this point where I physically am struggling to continue. And I wonder if I wonder sometimes if that was my way of removing myself from the environment to say, oh, I'm too sick, because I couldn't say I am struggling mentally. Yeah. It was easier for me to relieve myself of the pain by showing like, oh, I'm just too ill physically to continue. And I know that's irrational in thought process, but it just shows to me like the trouble that we have asking for help and saying like, hey, there's a problem. And I say it now because when I look back, I think, man, what if I would have asked for help? I would have tried to make the environment different for me. Like, would I still be in a surgeon or not? And maybe not. I think particularly not for me, because when I think about surgery, I think that prolonged sleeplessness and that sleep deprivation that was so detrimental for my own mental health is a component of surgery that takes a lot to know yourself, to know if that's a sustainable type of environment and career for you.
Yeah. I think that's so important to highlight here in your story, that often we are so disconnected from our own sort of mental well-being or lack thereof, that it takes some kind of physical collapse, some kind of physical illness or injury to bring us down and make us finally pay attention. And another thing to highlight here is, kind of what I think of as this kind of confusing overlap when we talk about burnout, when we talk about anxiety, when we talk about depression. It's really hard sometimes to tease those out. And sometimes it may not even be important for us as physicians to focus on which flavor of struggle we're in, right? So long as we are focusing on what is the right thing for me. How do I help me feel better? Whether that's a combination of, medications or therapy or coaching or any of these other tools that are really designed to help us get into a healthy place with our thoughts, right? Not just the absence of those negative thoughts, but, sustainable, positive experiences, that we all so want in life. So thank you for sharing that. I'd like to come back to this idea of feeling hijacked, because I feel like that's another sort of more common experience among physicians. Think about sort of the rigors of training, the, weeks and months and years of sleeplessness, and really the lack of control that you have over your life during those periods of time, and how for some of us that can really land us in, kind of these difficult thoughts where suddenly we're feeling like our thoughts are not our own, and like our head is just a terrible place to be. What is if you could speak a little bit more about that experience for you?
Yeah, I definitely will. And the thoughts too, it's like when I try to speak about it, I feel it takes me a really long time to try to explain it, because it's more of explaining how it felt, because it's very hard to explain the thoughts that were going through my head. They were when I read back on journals, it was clear to me that I was not thinking very well. And when we think about the modalities that might be recommended for burnout, such as what you were mentioning, therapy, medication, coaching, I think something that when that was first offered to me, I was saying, I'm not sleeping, I'm not eating, and I hate my job. And what did I hate about my job? So I loved my residency in terms of that was a really great fit for me. What I meant when I was so exhausted and I would just say, I hate my job, is because what I didn't like was the fact that it forced me into a forced sleeplessness. And I felt that we take away a lot of the very basic needs of being a human when we go into our training. And to then put yourself, when you're not able to eat, not able to nourish yourself appropriately, and then you're in a very high stress situation where other people's lives are depending on your decisions, that just felt to me so out of alignment with what I seek in life, which is very human connections and feeling nurtured and honoring the fact that we are humans.
Yeah. Yeah. I think, kind of the general population has no idea how chronically sleep deprived most of their physicians and other medical professionals are or have been, and the impact that has on the quality of our life, right? Not just it's not as simple as just, oh, well, you should go to bed earlier. There's many reasons, that we persist in these patterns of having difficulty sleeping. And some of that can be, certainly specialty dependent if you are on call, and especially if you're on call in a really limited field, right? You may not have any ability to get more regular sleep. And of course, we see all these studies about how chronic sleep deprivation is like having alcohol on board, right? And so we think about, why are we asking physicians to make healthcare decisions for their patients when we are walking around in this state where it's hard to think, we are slow on our feet, and we do that day and day and day out? It's recurrent. So I think that's really important to highlight.
Yeah, I can speak on that too, because I always wonder how much is necessary. When it came to call, I had a really hard time admitting how much I was struggling in call because I felt weak. And I think for me, one component of the thought, say if you do take call, it may be a point where, yes, I do have to take call, and how can I suffer less while on call? And so one thing for a thought process, when I was on call, I would be so hypervigilant and I would have anticipatory anxiety. So I would make that call experience even worse by thinking like, oh my gosh, I have to be available at all times. I have to get to the emergency room stat the moment that they page me. And so I was in this chronic state of really high arousal. And that chronic state of high arousal limited my ability to take advantage of those moments I wasn't being called. And so, that hypervigilance of all time. So my struggle with depression came after a very high, intense anxiety. So it was living very high, intense anxiety, and then I crashed. So it's been quite a repeat pattern for me. As it starts as just really, really, really intense anxiety. And then if you think the flame burns out, that's kind of what I now would think, it was probably burnout because I was on that hyper arousal.
Yeah.
So if someone's on call and they're noticing that same thing, is one thing that was helpful for me years later was like, oh, well, there's a whole team in the emergency room that's waiting to receive this patient. I can trust that they'll stabilize the patient, and then I'll get there as soon as I can. And that trust, that development of like, okay, the whole world isn't dependent on me, and that takes experience, and that takes trusting the team that you're working with to make sure that they are, taking care of that patient when they first come in. And then like the after effects. So when it comes to also the things I wondered, was some of the calls I'd get at 3 a.m. were for patients with constipation, and like, how can we set boundaries about what things can wait, and have that communication where the person that's helping, if somebody's on a shift and they feel it's important to get that message to you, like, how can we work as a team with our other healthcare team members to say like, I appreciate that you're on a shift and you're doing your due diligence to make sure that you relay that this patient needs a medication. And as an oral surgery resident, when I'm on call, I didn't have post-call. So in that consideration is like, would it be possible to wait until normal hours and to set that boundary of things that are pageable at a certain time of day and things that can wait?
Yeah, I think that's a great point. Is we often feel like there's no possibility of those boundaries for a variety of reasons, right? Our people pleasing parts are parts that want to make ourselves look invincible and tough, because that was how we got through our training, right? If we wanted to succeed, we needed to be, technically excellent, know all the things, be willing to do anything for anyone at any time. And I think that creates a lot of hypervigilantism in us. And again, I think that's something that tends to persist for many people, even post-residency. So thank you for talking about that. And I want to pivot a little bit and talk about the anorexia for a bit. I think anorexia is often something that medical providers run away from due to lack of training and a lot of other things. And it's considered, a chronic condition, and it's got these physical manifestations as you experienced, but also, these really strong, compelling thought patterns. And so if you are able to speak a little bit to that experience and what it felt like to be you in those moments, and having your education and sort of that duality that exists of, I know I'm sick and I know that this sickness is this thing, but I also feel this way.
Yeah, it highlighted a lot for me to be in medicine and to realize that there are a lot of unmet needs when it comes to understanding eating disorders. And for me, if I label anorexia as a coping skill, and we allow ourselves to understand it as such, and I'm not a medical trained expert in eating disorders, so this is through my own lived experience with anorexia. If I figure out where it shows up in my life, it's often to cope with anxiety, to cope with depression, to cope with traumatic experiences. And the way that my brain works, the things that make me feel better might be counterintuitive. I feel better when I don't eat or I move more. And sometimes, especially in diet culture, where that's held on a high pedestal, that can be quite problematic when you have a person like me that, or even I think it can be quite problematic because it creates shame in our society in a lot of different ways that it's presented. So I'm just talking about the way that our weight biases and our way that people communicate about food and exercise, because sometimes people are using those things as a coping skill. And so just understanding a certain person's relationship with food, with exercise, and with themselves, I think helps to create this easier way to understand eating disorders than just being afraid of it because it sounds really complex and it makes sense to me. I have trouble now understanding how people don't think the way I do. Mm-hmm. And so it actually can be quite challenging to know and accept that I may be ill. So even to hear like, oh, you're sick. I'm like, actually, no, maybe I accepted it and I was medically compromised. And I think also that allowed me to get help. When I got help for anorexia, I actually went inpatient more because I was trying to be able to think more clearly. So I didn't go in thinking, oh, I'm going to help myself, because at some points when you start eating disorder treatment, it can often be before you think you're ready. Mm-hmm. And so I went inpatient because I knew I needed to think more clearly. And I knew that lack of nourishment and lack of sleep were contributing to my challenges thinking clearly. And so I went in before I had to make a big decision for the Air Force. And I went inpatient right before I went to my appeal for the Air Force to see if I could fight to stay in. And that was my motivation to try to optimize my brain function. So if you can imagine like, well, that's an interesting thought, but doesn't sound uncommon to me to some of the things that might be going through someone's mind. Yes, it might be irrational, and let's keep talking and let's hear people's voices and their lived experiences, because the more we know, the more we can better understand what eating disorders are, what might be contributing and how we may better support people. Because I will say anorexia has a high suicide rate for people that are for any psychiatric illness.
Yeah.
And as someone living with anorexia, it is brutal at times. You know, if we think about, you need food to survive and your brain feels like it's painful to eat and you're anxious about food, and then people don't understand you, it can be quite lonely. And then if, you know, family members are really scared because they watch their child struggling and they don't know what to do, I think ultimately just stepping back and again seeing it as a coping skill, like what's going on here that might be contributing to this person's emotional state where they're using an eating disorder to cope. And for me, I think it's easier said than done, but really leaning into the whole self-compassion and learning ways to down-regulate my anxiety in a way that felt like something that I can control and that was true to me.
Mm-hmm.
You know, because if we talk about exercise and if we talk about yoga and we talk about deep breathing, well, if that's not something that you are resonating with right now, maybe it's not the best next step. But like, what would be the next step? Like, what would be something that I can physically do each day to start improving the way that I'm showing up and the way that I'm managing my emotions?
Yeah. I really resonate with that lens of the eating disorder as a coping strategy, because I don't think that you're at all alone in that. And many of the people that I talk with have, you know, stress eating as a component. And, you know, you just think about those as being, you know, similar interrelated coping strategies for dealing with extreme stress, right? So for some people, it's the absence of food, the restriction of food. And for others, it's, you know, eating to a point of numbness, eating to chase away, you know, feelings, eating. So really just kind of getting a better understanding of that in that light, I think is really powerful. You know, another example would be cutting, right? So cutting is a self-destructive behavior that some people have, and they're doing it because it relieves strong feelings that they have. You know, it relieves the pain of the thoughts that they're having that leads to their emotional state. So looking at disordered eating and eating disorders in that light, I think is very helpful, because it helps us to tune into what behaviors do we have that we use to cope with stress. And again, that might be food related, it might be alcohol related, might be some other, you know, high risk activity or something that's harmful to us. Over exercising as well as, you know, as well as under exercising, all of these things.
Yeah, and you hit it dead on with so one thing that definitely resonates is I wrote about how overeating and undereating are certainly often not opposite problems. I think society puts on a pedestal the undereating, and I heard one, you know, I hear quite commonly like, oh, I wish I was somebody that didn't eat when they were stressed out. I'm like, if you truly live that experience, you wouldn't say that. Like, it's easy to say. Mm-hmm. And also why? So a reason why that might be a thought is because society shames us for being in a larger body size. Well, that's society's problem. That's not your body's problem, you know, and just to name that for what it is. And I certainly resonate a lot with, I know a lot of people that have, you know, substance use disorder, and I relate a lot. And I just say, well, that's my anorexia. So I'm certainly not going to judge you for that. And how can I help you to heal? And how can we heal together? And I think, you know, as long as we have all these hierarchies in society, and some maladaptive coping skills are put on pedestals and some are shamed. And we just have to acknowledge that all of us are worthy of healing, and no one's maladaptive coping skill is better than another or worse than another. It's just whatever makes you feel better. And if that's doing you damage, then how can we help you to create a better coping skill that's healthier for you?
Yeah. Thank you. And I'm, again, sort of just thinking about the parallels with, anorexia, depression, anxiety, these chronic conditions, and thinking about how that relates to burnout. And I'm wondering for, any physicians out there who are currently experiencing burnout or not yet sort of tuned into that. And I'm going to use burnout as kind of a generic term for a whole host of the mental health manifestations that we experience. Or somebody who's recently come through that, with your experience in terms of sort of recovery and relapse, what do you want physicians to know about your experience of being through those cycles?
Yeah, I think identifying aspects of what I was still in my environment that we called them triggers. So things that were potentially contributing, what things that I could change in order to make the circumstances better for me, and what things didn't change. So if we looked at surgery and my decision making, I went and I thought, what components of surgery are contributing to this experience of high anxiety, depression, burnout? And is it something, as we say, we've got tools to help people with mindset. We have tools to help people improve their coping. However, if I improve my coping and then I put myself into the trenches of a lifestyle that really caused me significant distress, then I'm setting myself up back for relapse. So at those points, I really had to say, like, okay, well, I know. And I think for me, it became easier because it was a life and death decision. And sometimes we're in that messy middle where you can say, I can survive this.
Mm-hmm.
Or we feel we have to prove that we can survive it. And what if we can open our mind? I'm in Martha Beck's Wayfinder Life Coach program for my own healing. And I will definitely share those tools with as many people as I can help in the process. And it's all right now we're thinking about what would be your ideal day and what are your wildly improbable goals. And that really allows you to think and explore. And often it's interesting, it's very common for myself and for other people. We haven't yet explored the possibility. I know for me, it was eye-opening. Like, I don't have to be miserable. Like, wow, I'm feeling like I'm checking off all the boxes. I have a career that I was told I should want, and would be, something that I'm checked all the boxes to get here, and I'm feeling some unrest, and I'm feeling that my heart is pulling me towards the very simple things in life. Like, I don't care about my degrees, don't create the value that I'm seeking. Often what I had to do to obtain those degrees was taking me away from the things that were meaningful. And the thing that I really changed my perspective and allowed me to really start again, this is a lot, like a strong relearning process.
Yeah.
But when I was on call in 2016, I got a call from my ex-boyfriend, who I was still very in love with. And I hadn't slept in a really long time. And so I looked at the phone and I'm like, oh man, it was like 9:30. It was late. And I thought, I'll call him back tomorrow. So I texted him in the morning to let him know and try to set up a time. And the next text I got was from his sister about his passing over that weekend. And I live with him in my heart, in the driving force for every decision I've made ever since. I was so upset with myself for prioritizing the things that really are insignificant in the grand scheme of life. And he will forever live in the people that knew him, because his passion for life and just love for the world was so contagious. And I felt like he was somebody that really valued deep connection. And I don't want everyone to have to experience that deep loss before they start to live in a life that's within their integrity and that has great meaning for themselves.
Yeah, I think that's such an important point of, we don't have to continue to be miserable, that we have choice and agency. And, if you're finding yourself in this situation where you don't feel joy, you can't connect with the ideas of happiness or really think that your future could ever be better, that's a moment that you need to be really in full awareness and be getting the help, whatever that looks like for you, that you need, so that you don't have, we don't look back on our lives, filled with regret and rage and sadness for all the things that we've missed. Right.
Yeah, absolutely. And I think that when I was in the thick of surgical residency, I thought I had to stay or take my life. I was so tired. That was not the point that I should be making. And this is for anyone that feels like they're in the thick of it. And we have a kind of a learned helplessness in medicine. And because we're used to that being the status quo and what we put up with.
Mm-hmm.
And for me, it really took taking a step out of the environment. It took trying to prioritize. And this, you're talking about the recurrency and the relapse. So the first time I took leave, the whole time I was coaching myself back into residency. So we can actually use coaching against ourselves.
Absolutely.
I didn't even know what coaching was at the time. I wasn't a trained coach, but I think in medicine we start to develop the skills to coach there. And I was like, I can do this. I can. And it's my confidence, or it's like, I needed to prove that I could do it to myself. And even now I have an unfinished residency, and how many times I've woken up and thought, I need to finish that. Right. Like I really feel the need to finish that. And I think it took me a long time to even speak up about it, because I'm like, what if I want to go back to finish it? And then I thought, well, what if there's people that are losing their lives because we're not talking about this? So that's what took my priority to start speaking up and starting this conversation. It's for my own healing, and to hope that we can all speak up and heal together, and to acknowledge that, I do feel that desire to finish something, and what's that about, and explore that a little bit more. And what that led to is acknowledging, like, sometimes our value is still within those titles and those identities.
Mm-hmm.
And what did I gain by leaving? Because we often think about, what did I lose by leaving?
Oh, yeah.
Like, what would I gain if I pivoted? And it may take some time to just rest in order to think clearly. And it may take being around people who have done non-traditional paths and change your environment in order to allow your mind to really explore new possibilities.
Yeah. I'm so glad you said that. There's an idea, right, that we just need rest. If only we had rest, and, perhaps we take a leave, perhaps a vacation will fix it, or commonly maternity leave, or, physicians who are out there who are hoping, well, maybe if I just get a kidney stone, or if I'm in a minor car accident and I'm not too badly hurt, but I can't work. A lot of those sort of fantasy thoughts of, if I could just get some rest, if I could just be away from this, I'd be all better. But so often, we return to that same environment unchanged, except maybe we've slept more. The same sort of thoughts and feelings, though, driving us. And that's not recovery.
Yeah. And it's thinking too about the people that do enjoy their day-to-day and their life and are needing things, like, what can we bring into the system so that not everyone feels they have to leave if they really do want to stay.
Mm-hmm.
But how can we change their circumstances that promote healing? So if you leave, exactly like you said, like, making sure that the things that were contributing are things that are modifiable, and if they're not, then considering what that next step would look like for you. Because what happened to me was that I went from, again, I share my experience because I did a lot of things I wouldn't have done again. And that's why I like to speak out, so that people can know, because I feel like it would be a common theme that we want to get back into the trenches right away as soon as possible.
Right. Armored up, tougher, stronger, better.
Tougher, got this. So I went for my first FMLA, and all I did the whole time was, like, the whole plan I had fallen apart. I had established, like, a weekly plan with a psychologist, and, like, it turned into a very non-structured time for loss of that provider. So then all the time I spent was preparing, I think, for step one, USMLE step one. I'm like, which was so foreign to me because I was a dentist. And so I spent that time doing that and not resting at all because I was not ready to face the discomfort of my own emotions.
Yeah.
And so I went back into residency, and thankfully it was medical school, which I really enjoyed. And then I did the surgical rotation and realized, like, yeah, I like medicine a whole lot. And then I heard that whole thought of like, if you like anything more than surgery, do it. And I really had to sit with that. But then my mind was like still wanting to try to be a surgeon for, I could do it. And everyone said, if you could do it, you should do it from the dental world. Like, if you can do surgery, why wouldn't you? Like, that's surgery. And so it's like, I had these conflicting thoughts in my head. Was in medicine, if you could do anything else, you should do it. But then in dentistry, it came like, because it was such a prestigious thing to do surgery, and like just trying to figure out, taking a step back and being like, okay, the external validation is toxic. It's like, just like, whatever you do, just make sure, like, try your best to make that not be a thing. And that will be a relearning process for us all too, because it's like, wow, I've been doing that my whole life, and now you're telling me to try to switch it, and it's really hard to turn off.
Really, yeah, it's a process, right, to get out of that and start to trust yourself.
Exactly.
Like, oh, I have choices to make. I can make the decisions. I can set boundaries, and bumping up against the discomfort of other people, right? And we don't want that, right? We don't want to make other people mad or uncomfortable or sad or inconvenienced.
Yeah, and we've been numb we often, in order to survive traumas, become numb. So anorexia numbed me out. Just like, hurting, inflicting self-harm, just like substances can do. They can numb us out. And so when we get to a point where I relieved myself from the situation, I was disconnected and disassociated from myself. And so there's that period of healing that requires the discomfort of getting back into your own body. And if you have very high trauma responses, that, working with a trauma-informed professional, whatever that looks like for you, for me, it's been like movement therapy and things like that. It's just like, there's so many different options to explore and what might be best for you, and crawling back into your own body. And I will say it was an extremely uncomfortable process, and I wasn't ready for it. So when I wasn't ready for it the first time that I was deciding to leave surgery. And so when I was at the end of my it was my fourth year. So right when I was about to graduate from medical school, which was my third year of surgical residency, and I had decided to go inpatient for anorexia in order to optimize my mental function so I can decide about what I was going to do for my military career. No, certainly wasn't like, oh, self-wellness is first top priority. So I'm just going to speak this out so that people can appreciate the reality of what this thought process sounded like. Inpatient, I was emailing to get my next job established just in case the military kicked me out. I was hyper focused on what my next best step or my next steps would be. And I was not resting. I was not focusing on developing coping skills in order to prevent this problem or really exploring. It just was such an uncomfortable thing. And I was so disconnected. And I also had learned that there were gaps in understanding of how to approach eating disorders. So I felt like I was a little disheartened by that, and I wanted to bring the humans back into healing, into hospital systems. That's part of my reason. It was from an experience as a patient. And so when I ended up leaving the military and the surgery, the next day I started my other residency. So as you can tell, I didn't provide that opportunity that I now advocate, is if you can take time off to really take a step back and reset, and not just run away from something, but really try to reset so you can move towards something on your time. I would highly recommend, if I had to do that over, that would be the appropriate next step.
Yeah. So if anybody out there is listening, and currently sort of struggling with that, emotional exhaustion, feeling overwhelmed, stuck, having thoughts of self-harm, or aware of some other way that they're harming themselves, right, through, stress eating, substances, any number of other behaviors, one thing that you definitely recommend is a pause, right? Time to be able to really think and sort of identify again with yourself.
Yeah. And I'll tell you, I really want to tell you why too, because what happened to me is I did this 2 years additional residency and I was burnt out the whole time. And that was really hard. And I appreciate the people that were with me at that time, as I felt like I was on survival mode. But as I finished that residency, I had a month between that and becoming an attending, because I had never, we think I don't have time to take, I do not have time or resources to take time off. And I would say you often don't have time not to, because what happened to me is if I would have taken that short-term interval of rest, I may have had long-term successes that would have reduced the amount of suffering. I kind of just prolonged my suffering with burnout, and I ended up really struggling and almost losing my life last year to complications from anorexia and burnout. And again, that's what prompted my speaking out, because I'm like, this is a cycle I can't keep staying on. Like, I need to do something different. Yeah. And in committing to my own recovery, if I'm going to do this out loud, because one, that's accountability. I'm also hoping to help bring other people on their own journeys alongside. But that was a huge component. I'm like, hey, you know what? I'm going to try something different here, and I'm going to practice what I preach, and we'll learn this together. And if I can support someone that might be a couple steps back to where I'm at now, then great. And people that are a couple steps ahead of me are helping me. So it's a pretty awesome community to be part of. Yeah,
that's so helpful. And I'm going to have you come back sometime, and we're going to be talking about the label of high functioning, which leads right into everything you just said.
That sounds great. Yeah, we can definitely talk about a lot of things. So,
tell us how we can find you. How can people, learn more about what you are doing?
They can certainly find me on LinkedIn and Facebook. We have a group for anyone that's resonating that you're part of my admin team for, is Permission to Pivot. It's about healing, life and career transition support. And then Facebook's just my name. And then I do have my coaching is professional leadership coaching. So JillianRigertCoaching.com. But again, to support your experience, I think Facebook is such a tremendous community that we have. So I'd really advocate for you to join that group.
Perfect. And I'll be putting those links into the show notes so that other people can easily find you.
Awesome. That sounds great. Thank you so much. And thank you for having me.
Yeah. Thank you so much for joining me. And like I said, we'll definitely have you back for another wonderful discussion that is so helpful and moving the whole conversation forward, right? About mental health and, ultimately mental and emotional wellness for us. What a concept, right?
Yeah, absolutely. And if anyone has any particular questions for us to answer together, please let us know.
Yeah. Thank you so much. And join us again for our next episode. If you have enjoyed listening to us talk, please be sure to share the episode with others, as well as like, review, and subscribe. All right. Until next time. Bye-bye. Physician overwhelm. If you learned something today or felt moved, please share this episode with a colleague. You can also learn more about me and my coaching practice by heading over to www.healthierforgood.com. And of course, be sure to like and subscribe so that you don't miss an episode. Until next time, take care.